So the next question was about symptoms of COVID-19 long haulers. So the older population and people with more chronic medical conditions are the ones most likely to experience COVID long hauler or post COVID-19 syndrome. However, young people can also have prolonged courses of illnesses for weeks or months after the acute infection. The most common symptoms are fatigue, shortness of breath, cough. Other symptoms that are less common include body aches and joint pains, chest pain, headaches, loss of taste and smell, brain fog, memory and concentration issues, insomnia or sleep problems, fast or pounding heartbeat like tachycardia, and rash or hair loss.